As we begin our New Year focus training for 2023 E&M changes and our revisions, I'd like to encourage everyone to refocus your efforts on column 3 of medical decision making. Hi, my name is Shannon DeConda with NAMUS. So the header of column 3 is very specific in its wording. I think sometimes we fail to notice that because we're stuck in the way we used to look at this column with 95 and 97 documentation guidelines. MDM favors the table of risk that we had with 95 and 97 documentation guidelines. And column 3 favors column 3 in the table of risk, which was then patient management. And the title of column 3 does include the terms patient management. However, what it really says is the risk of complications and or morbidity or mortality of patient management. What we fail to remember that we are including in column 3 with 2021 documentation guidelines is the risk of complications, not just patient management. And what we fail to remind providers is when they are documenting the patient management, they are not only documenting patient management. So most of the documentation we've gotten so far utilizing 2021 documentation guidelines has continued to rely on documentation of merely managing the patient, as opposed to the risks of managing that patient. How do we document for this shift? Well, AMA has said, has the patient reached their treatment goals? We've picked up on that one. AMA has said we can write the considerations of other treatment. We've seen some of that, but the probables, the rule outs, we've had some documentation of that, but also all of the other risks. The risks that our provider is taking on, the thought process, the entire risk of everything about that patient, of what's going on. So when we take a simple patient that a provider, we go back to the example oftentimes that a provider gives us of a patient who is receiving an antibiotic or a steroid injection who has an underlying comorbidity, which has to be taken into consideration prior to giving them that new medication. And they have to consider the status of the comorbidity first. That type of risk of managing the patient is absolutely what the AMA is ensuring that providers are counting in that risk. But our providers have to document it. That is part of the risk of patient management. And that's what we're really missing in the documentation. That's definitely what is missing when we have copy and pasted assessment and plans, and when we have minimal documentation and assessment and plans. We need to help our providers understand, regardless of type or place of service, inpatient, ED, clinic setting, when we are documenting assessment and plan, we really need to understand the risk of managing that patient. Even if you're consulting that patient to another service, you are responsible, you are managing that patient until they're picked up by that other service. That risk should be documented in the chart. So if you have any questions about this, please feel free to drop me a line, make a comment here, and I'll do my best to help you. But explore this. Help your providers understand, and then see where this can go for documenting and what it means. And that's again why they've removed some of these examples and then again reminded us these are only examples. And they're examples of treatment and not examples of risk. So again, consider this amongst your auditing and coding team, and then again, have some provider meetings about what this means to your specialty's documentation. I hope this is helpful for you today. And again, I hope you'll contact me if you have any questions or needs within your organization. Thanks, and have a wonderful day.